Hi everyone, my name is Professor Donna Hall and I'm currently the chair at Bolton NHS Foundation Trust and also chair a think tank called New Local, whose mission is to try to promote community power, unlocking community power across the UK. So my background is I've been a chief exec in local government for around 20 years. The last job that I had was in Wigan, where we did something quite remarkable with the local community that you may have heard about called the Wigan Deal. If you are interested in finding out more about the Wigan Deal, then the best thing to read is a publication by the King's Fund called Lessons from the Wigan Deal, which was published around a year and a half ago. Real kind of driver behind the Wigan Deal was a new social contract, a new relationship with citizens. And it didn't come about overnight. We didn't suddenly go to bed knowing we had some problems and wake up with this great solution. It was an iterative process that went on and kept being refined all the time over a 10-year period. And what the King's Fund said about the deal, and I'll talk about the outcomes in a little while, was the things that made it different to other places and projects and initiatives that they'd seen was, firstly, clarity of purpose, really simple and clear mission about what you're there to do. And I think for any partnership like your own, that's so important that you're crystal clear on purpose. And very often organisations just drift into doing things they've always done, or when new pots of funding become available, they go for that. And they're not clear on purpose, or it becomes ill-defined over time, or different people in the partnership have a different perception of what the purpose actually is. So that's something that, again, I would encourage you as leaders in the system, and everyone is a leader, we're leading from every seat in the room, whatever your role is, to really be clear about purpose and clear on it, and communicating that to each other, to wider partnerships and to local people is really important. So clarity of purpose was the first lesson from the Wigan Deal. And the second one is constancy of purpose. So very often we tend to chop and change our strategies, our plans, our mission statements, depending on the different leaders that come into our system, depending on feedback that we get, or depending on the kind of pot of money that becomes available from Sport England or wherever in that particular year. But I think having that really long-term constancy of purpose, you know, where you stick with the same brand, you stick with the same messaging, and it's everywhere and everyone understands what it means and they can explain it back to you. I think very often people overcomplicate strategy, make it really obtuse so that no one really could tell you what a strategy says. Very often we have overlapping strategies that don't link together. My background is kind of strategy, policy, regeneration, and working with communities. I've done that all my life, and I've seen lots of strategies and written lots of strategies that haven't worked. The only one that has worked is the deal, really. I'll be honest, that's simplicity. It describes a relationship rather than a set of objectives, a really clear relationship with citizens. So we started back in 2011 with the deal, where we wanted to create a different relationship because we had no money. That was the first point. We had to make £160 million worth of savings, and we were third on the list of cut councils through austerity right at the start. We were watching councils around us try to chop bits off services and reduce services or raise the access threshold for services, and we thought that was really counterproductive. We basically were telling people, go away, get worse, get poorer, get more in debt, get thinner, be drinking more alcohol, and then come back, and then you can access our services because you're bad enough to access them. And we kind of thought to ourselves, what do we have? We've got to make all these savings, but our assets are our people, both the staff in the council, 5,000 brilliant people, 85% of them live in the borough, and also the people who live in the borough. They're our assets, 323,000 amazing people. So let's tap into what we do have rather than concentrate on what we don't have and make salami slice savings chop across a wide variety of services so that they're basically stretched paper thin and they fall over. We also at the time, so that was the first thing, having no money and knowing that we had to redefine our role. Second thing was the fact that we did a piece of work with a woman called Hilary Cottam, who many of you will have read her book, Radical Help. We invited Hilary to come in, so we're going to do some work with us in a place called Worsley Mains, which is one of our more deprived social housing estates. We asked her to work with 25 families whose children were on the edge of care, being taken into care. And we tried to work out what were we doing wrong with these families and why were we in this position. Many times it was generational. children being taken into care whose parents had been taken into care. And we mapped out on a wall over a 20-year period all the different interactions that we'd had, whether we were in the police, in social care, in criminal justice, in drug and alcohol services, housing services, Department of Work and Pensions, and costed it all up. And in a year, the families were costing the state between $250,000 and $500,000 per year per family. And at the end of that year, each family was in a worse position than they had been at the beginning. And what we found, we were spending money on continually interacting and transacting with them around a kind of assessment and referral model. So we weren't building a relationship with them or trying to help them or unravel some of the problems that they had and think about, as neighbours, how could they work differently in the local community, public servants, to support people, to be better connected, to have that infrastructure, to develop a network of a social support network around them, rather than have the state constantly doing what it was doing at great expense and not very effective outcomes. So that was the second piece of creation of the deal. The third thing was a piece of work we did with Nesta. I'm sure you've heard of them, around creative councils and adult social care. And we found very similar findings. We were assessing, referring separately to each other. We didn't have a plan for each individual person who required social care. I remember myself when my mum was discharged, and you'll have similar experiences yourself, discharged from hospital. She had 22 different bits of the NHS and social care descended and came up her path on one day. It needs project management. So that whole system is expensive and it's not person-centred. It's not focused on the person, what support they have in place, what they like to do as a person, what really drives them, what their passions are. So we completely, with those three factors, no money, the work we did with Hilary in children's services and the work we did with Nesta in adult social care, realised we had a problem. And so we created a different way of working. We called it the deal. The first thing we did was to freeze council tax for 10 years, because we realised that austerity wasn't just hitting us, it was hitting people. And eventually, after 10 years of freezing council tax, we worked out it was the equivalent of around £500 per year per family. So it's quite a bit of money there for people, that's in people's pockets, rather than being spent on propping up services that are not effective. So again, my background, I'm adopted, and I've got a passion for kind of quality public service. I've seen the impact of having really good public services and getting really great outcomes by using the assets and the people in a place. And that's what kind of drives me to do what I do. It's great that there are people here from the NHS, from the community and voluntary sector, from local government, from sports organisations. It's brilliant that you've got this fantastic partnership here. And the strength of partnership is amazing. But very often we design our own individual programmes and fiercely protect them and don't work together to co-design them, either with each other or with communities. So for me, the only thing that brings together all the disparate programmes and partner agencies is place. So it's neighbourhoods. And one of the things we did, which again really made a difference, was we developed integrated place-based teams around populations of 30 to 50,000 people. And all the international evidence points to the fact that is the best footprint of a neighbourhood. It's quite a large neighbourhood, but it's functioning as a way of getting public servants to talk to each other in a place about people and families and put in place the support that they need. People were given the freedom, the free rein to do what they wanted that would make a difference to the individuals and the families. And as long as no one died, we gave people the courage and we backed them to succeed. And on the walls of the place-based teams, people wrote, "Don't do anything if it doesn't help the family or the person." So when we looked at some of those 25 families Hilary was working with through the Life Project, and she talks about this in the book Radical Help. Some of them were on the edge of going into prison. Some of them had unserved sentences of a week, but they were scared of going back into prison. They thought they would lose the children. We had one woman in particular who had basically got bipolar disorder but wasn't on the right medication, was terrified to leave the house, wouldn't answer the door when we knocked on the door, and we were about to evict her. You think, what would be the outcome of doing that, of evicting her, sending her to prison, but not sending the children to school who were being bullied at school? So trying to rebuild that family's confidence and self-esteem, starting with the mum by getting her medication right, helping her to get volunteering role and then a job, and working with the children. So, you know, we might have badged those children as obese, but obesity wasn't the main issue in their lives. There were many other things in their lives, you know, so an exercise program immediately wasn't the right thing. It's that relational model, that deep listening to people, that really makes the difference. We employed an anthropologist who's brilliant, freelance anthropologist who's based in London and is available for work if you want him, Dr. Robin Farrow, and he helped us to redesign the way we engage with people, the way we listened to local residents, rather than making judgments about their lives and what is best for them, but having a blank mind and listening, deep listening, ethnography, the study of how people behave, the study of society and what makes people do certain things. And I think for the work that you're engaged in, that kind of deep listening is so important to individuals and to communities, or else the things that we design, the programs we devise, will just be completely useless because they're not grounded in reality. So every single thing that we commissioned, and I was the accountable officer for the clinical commissioning group as well as the chief exec of the council, was co-designed with local people. We did some work on a reimagined sexual health service, for example, which previously was a really old-fashioned, almost Victorian service, really confusing and not based on the needs of particularly young people. So we worked with groups of young men and young women to redesign that service around their experiences and the day-to-day reality of their lives and what would work for them. So it's critical that deep listening is part of every single thing that you do. We did something similar with drug and alcohol services as well, where we used people who'd had lived experience of drug and alcohol issues and then helped them to pull together programs and gave them the freedom and back them to redesign those programs. And quite different to how a CCG normally commissions services or a council, which is in a darkened room with no exposure to the reality of people's lives. We also did, with Robin Farrow, some work on going into local communities, everybody who worked in public services, and having the Be Wigan behaviours training, where we talked about how we can be positive, accountable to local people, and courageous. So the whole idea of the deal was to prevent, and we had some fantastic successes. So the main outcome that the King's Fund highlighted as being a great success, which others have found useful, is healthy life expectancy. So that's the number of years that you live with good health. So in Wigan at one point it was only 50 for men. We funded 500 amazing projects. We didn't top-down commission them because we thought we knew what people wanted. We asked the community what they wanted, and we put 13 million into that over an 8-year period, and 500 amazing projects were funded. Importantly, they weren't based on micromanagement of those projects. We said, look, we trust you to deliver the outcomes you said you will. Go away and do it. We're not going to micromanage you. Go away and do it. And in return, because the nature of the power shifted to them rather than us holding all the power and spending more on micromanagement and monitoring of the projects than we were actually giving them, we found we got much better buy-in outcomes, the trust built between public servants and the community and voluntary sector. And it was that additional 7 years in the most deprived wards of healthy life expectancy that we managed to add during the period of the deal. I just wanted to say something as well about measurements. You tend to get boards who are cabinets, council cabinets or steering committees who are a bit obsessed with measurement. And sometimes they feel it's their job to kind of beat up the executives because they're not achieving the KPIs in a particular quarter or a particular month. One thing really brought it home to me about how measurement is an imperfect science, and how sometimes we obsess and we spend all of our time and energy on measuring the wrong things. So there was a guy who was often coming to Wigan Hospital. We risk stratified people who were coming into hospital for an unplanned hospital admission in Wigan, and we found that there were, out of a population of 323,000 people, there were 4,000 people who were at risk, and we thought they would be all older people at risk of a fall, but they weren't. There were people, half of them were people in their 40s and 50s with mental health issues, drug and alcohol issues, very poor social connections, joblessness, depression, lots of things going on in their lives. And they were just kind of in a spiral, a revolving door of going to different places, and no one was really helping them. And this one guy in particular stuck in my mind. So because we'd met every single KPI in relation to this gentleman, he wasn't on anyone's radar, but he was going to hospital, whether it was Wigan or Leigh or Bolton, because they're quite close to each other, every single day for a year. But because we'd seen him within a 4-hour time frame, which is the target that the NHS measures obsessively, 4-hour waits, no one had actually twigged there was a problem. There'd been inadequate liaison with his GP around his medication, no liaison with anybody from the Department of Work and Pensions, no liaison with his family or mental health services. But according to everybody in the system, everything was fine because we'd met the KPI. So we're measuring the wrong things, aren't we? We need to, I love broad-based outcomes measurements. So healthy life expectancy, is it going up or going down? Where is it going up? Which locality is it going up in? Data is important to drive decision making, particularly when you come to risk stratifying and prioritising where you put your attention. Have to find a way of measuring, but it's great that integrated care systems now have got a bit more freedom to do that. So I think it should be around distance travelled, gaps closed, physical activity improvements in an area, and particularly looking at not that kind of standard KPI measurement, but the quality of what the kind of support that they've had and how they feel. Those human stories are always much more powerful than that cold KPI that doesn't really measure the right thing. But it's still going. It wasn't about me or the political leaders. It was about a place and a plan for a place, which is a long-term plan for a place. So you're ideally placed in this partnership to do that. You've got longevity, you've got plan, you've got a plan, you've got buy-in from the partners. So it's really, really exciting. But you do need courage. That's the one thing that you can't get through a government funding pot. You need to have the courage of your convictions to really shake things up. I mean, the one starting point there to back you on your courageous journey is if we carry on doing what we've done for the last 40, 50 years since the creation of the welfare state, we're doomed because it's on a crash course for failure, because we've got increasing demand, reducing resource base, and lots of other pressures on the system as well, with other things that are happening in the world and in the UK. So we've got to try new things, but leaders need to think outside of their traditional barriers of thinking, and everyone needs to have a role in leading this. We've got to trust our frontline people to get on with it. Vampires in the system, whether they're sat on the management team or whether they're on the front line, need to be exited. I'm sorry to say it sounds horrible, but there will be people who'll be trying to block this different way of working. And, we've not got the time to mess about with the naysayers. Skepticism is healthy, cynicism is not. So, some bold recruitment decisions are needed by everyone when you're trying to do stuff like this. And keep smiling, because this is, what is the alternative to this kind of different way of working? Would encourage you to read Lessons from the Wigan Deal and Hilary Cottam, Radical Help, and hope you have a great day, and I'll see you later on the panel.